Hello viewers, welcome and thank you for joining me in our today's episode of the Public Finance Trail Program. My name is Regina Kinyo-Lando and with me are our resident panelists. On my right is Mr. Timothy Kiprono, a program officer in charge of governance and social development at Kerio Center. And on my left is Mr. Emmanuel Kongin, assistant program officer in charge of governance and social development at Kerio Center. Welcome to the program. In our preceding episodes, we've looked at public participation and the role of sector hearings in the budgeting process. And today we want to go to the details of the public participation and with reference to Uasin Gishu County. Gentlemen, Kerio Center has been doing advocacy, public budget advocacy in Uasin Gishu County and among other North Rift counties. And I believe you have a lot of experience in as far as the public participation is concerned in those counties. Mr. Timothy, what's your view of the public participation process in Uasin Gishu County as a whole?
The process of or devolution generally is the learning process, like in any other county. So Uasin Gishu is still learning, trying to understand what is working, putting up systems and the rest requirements that requires devolution to kick off well. Mm-hmm. And but there are few things that cannot be curtailed by this learning process. Some of these include public participation, things to do with access to information such as the budgets and related documents. So I mean, those are things that doesn't require learning process. Those are obvious processes that should happen. So those things currently are not happening, as much as people are still learning, but those things are not coming out. You can't access budgets. The public participation is still not good enough. As much as it's, well, in Kenya it's a requirement now, but it's supposed to be a good practice. Yeah.
Mr. Kongin, Kiprono has just said that the public participation process has not taken off in Uasin Gishu as it ought to have been. And how does the public participation process happen here? You can just give an insight of that.
All right. With Uasin Gishu as a county, most of the public participation is happening around capital expenditure. And this capital expenditure is about projects, the development side of the budget. The recurrent side of the budget doesn't have any discussions in this county. And to address the issues of like social health care, for example, the recurrent expenditure is very crucial for this kind of department, for example, because it is a recurrent, intense department. So if you look at the current budget for Uasin Gishu, for example, the allocation was the largest for the budget for Uasin Gishu County. And to be precise, I think it was about Kenya shillings, about 1.5 billion for the whole budget. And out of that full amount of 1.5 billion, only about 300 is what is going to capital expenditure. The rest is recurrent expenditure. And
when you're talking about recurrent expenditure, what exactly do you mean?
Now, when you talk about recurrent expenditure, it is about like staff emoluments, operations and maintenance, expenses that actually are spent every month. It's this, like it's a cycle. This month you are spending on this, paying salaries. The following month it's the same thing. But for development expenditure, which is about infrastructure, it's a very small component of that budget for health. Yeah, and you also need to remember that for such a department, if we are only asking the public about the development and they are having a challenge, let's say in the way medical supplies, access to medical supplies and generally the health services that they get, and they don't give an input on what should be increased in the recurrent expenditure in the budget, then the whole process is not really going to solve the challenge that the public are facing, in this case, which is access to these services. So if you're only asking them about buildings, for example, you're asking them about those infrastructural developments in the budget, and they are not being asked about, like, do you feel that the staff are enough? Do you feel that the medical supplies are enough? Do you feel that the ambulances are running smoothly? Then, I mean, they are not going to get to participate in a way that is going to help them.
And Mr. Kiprono, Mr. Kongin has just explained to us how the public participation process goes on in Uasin Gishu County. And again, now can you explain it in details how the process should be?
Yep, I mean, look at public participation as a dialogue. You know, you're discussing, I mean, to come up with acceptable decisions. So, I mean, so it is supposed to be, I mean, it is based on the belief that those people who are affected by a decision are consulted prior to making those decisions.
Sure.
And, well, the other thing that public participation or how public participation should happen is, like I said, it's a dialogue. So it's a two-way communication. The government says, I mean, we are making 1, 2, 3 choices this year or for the next budget or something like that. And then the public comes in and say, okay, well, those are good choices, but we think you should, you know, make a bit of changes like this or this or like that. So it's a two-way communication and collaborative approach where we come to a table and say, okay, we want to go this direction in the next financial year in terms of policy direction and something like that. And then the public says, okay, that's good, but can you add or subtract 1, 2, 3 things here and there? And so, well, in the absence of public participation, there are a lot of or when public participation doesn't happen the way it's supposed to happen, then you will see a lot of confrontation and disagreements between the government and the people who are supposed to benefit from those decisions. So, for example, if the government is making decision on to improve healthcare, and then, you know, at the end of it, it's like, I mean, what is brought to the table for discussion is just infrastructure. Then at the end of it all, the public concern, which Kongin says, for example, and uses the example of access to medical supplies and generally healthcare, then it will be like, I mean, so we had public participation, but we discussed the development part of the budget. We discussed capital expenditure, you know, we discussed infrastructure, we discussed machinery and whatever we discussed, but we didn't discuss the core issue around the healthcare. We didn't discuss whether if we are missing medical supplies or if I'm going to hospital, I'm waiting longer than I should to get the service, then we are not addressing those issues. If I'm going to facility and then I'm getting prescriptions to go and purchase medical supplies from private facilities, then, and we are discussing what is brought to the table for discussion is infrastructure, then we are not addressing my problem. I'll still go to the facility next time and I'm given prescriptions. I don't get the medical drugs I want. I take long waiting, you know, because maybe the staff are not enough or something like that. So at the end of it all, we will still feel like, I mean, in other countries or in other counties where people are empowered or enlightened, people will start demonstration. People will start, you know, like, I mean, we don't go to facilities. We boycott the government services and use private services. And what happens in that situation? So the government will be embarrassed. Like, I mean, so we made decisions on behalf of the public, but then those decisions are not resonating with what the public wants. So at the end of it all, it will be like, I mean, we are not doing the right thing.
Sure.
Yeah. So the public participation should be a dialogue about the whole it's like holistic decision. So this is what we are going to, this is the decision that we're making, and open up everything. Not just because now the discussion, like Kongin is saying, is we are discussing capital expenditure, and that's actually what happens in Uasin Gishu. We are not discussing the recurrent part of the budget. So we are just discussing capital expenditure, which is, we are missing the whole point. Agriculture, health, education, those are the departments that we need to discuss recurrent. We need to know what is going to personnel. For example, extension services in agriculture. For example, ICT teachers in education. So those are the things that should be brought in the table. Like, I mean, so if we have insufficient personnel to give us these technical services, then what is needed? Do we need infrastructure or do we need this personnel to be increased? Do we need infrastructure or do we need supplies? You know, medical supplies, textbooks in ECDs, you know, pesticides and or disease control supplies in agriculture and something like that. What do we need? So that is the dialogue that should happen. But then we are not given that part of the budget to discuss. Yeah.
So, Mr. Kongin, what are the benefits withdrawn from effective public participation process?
All right. With an effective public participation, we have better outcomes and improved governance. This is what, simply put, it means that when this is done correctly, like for example, use the example of medical supplies, and the government listens to what the public wants. Let's say, for example, they feel that in a certain health center, the crucial thing for them is, say, an ambulance, and that one is provided. And then there is another case where they have the ambulance, they have all in the infrastructure, but the need is on medical supplies and, let's say, personnel. So if it is an effective way, then they'll know which health center or, say, dispensary needs an ambulance, which is an infrastructural, which is a development kind of thing, and which one needs services to be improved. Let's say they employ more personnel and they provide more medical drugs.
Mr. Kiprono, your addition on the same?
Yeah, I think there are a lot of benefits that comes with public participation, and one of the things that comes out of public participation is those decisions that comes out of the dialogue. I like calling it dialogue. That comes out of the dialogue are implementable. And people understand the stakeholder or the people who benefit from these decisions, understands those decisions, and they are better placed to participate in also implementing. The other thing that happens out of a good public participation is communities are empowered, or the public is empowered to understand like the other ways of solving challenges or social problems, for example, besides confrontations or disagreements or boycotts or something like that. Look at what happened in Kiambu last time. They went to court to stop the government from implementing services and all this kind of thing. It was out of that, because they didn't have the capacity to participate or demand 1, 2, 3 from the county government as a result of the county government or failure to conduct meaningful public participation. So at the end of it also, so these two things happen. So one is the decisions are implementable because it has the blessings of the public, and then the second thing is communities will learn to understand, so there are other ways we can solve our problems. We can engage with the government proactively, we can discuss with them, we can understand why the government made those kind of decisions, and the government will understand why the public feels like the decisions that we've made, for example, are not the right decisions, for example. So it's like we are learning process. So continuously, communities will be empowered, and if those decisions are explained with notes about why we are making this choice, the reason, why we are not going for that direction or we are going this direction, people will understand like why are we making this choice, where are we going with this kind of choices, something like that, and they will be able to understand the government well. So with that, we'll avoid a lot of confrontations, disagreements in the race.
And suppose a due process in the public participation process is not followed, what are the consequences?
Of course, there are a lot of consequences. Like I said, public participation should be a good practice. It shouldn't be a requirement. Like currently counties are just doing for the purposes of meeting a requirement of the Public Finance Management Act, as opposed to, by the virtue of people benefiting from the decisions that we make as government, let's consult them so that we understand whether the decisions that we are making resonates with what they want.
Because they are the major beneficiaries.
Yes. As opposed to that, so it's like when we do that kind of participation where we just want to meet a requirement, then we are not addressing, we are not linking the decisions that we make with what people want, with their needs and preferences. So at the end of it all, it will be like, take for example, license fee. So the government is supposed to consult public about their taxes. Like, we are going to increase taxes or maintain taxes or whatever, this kind of thing. So what happens at the end of it all is when you call people for the purposes of meeting a requirement, then you're not giving them a fair chance to say, okay, look, you're increasing the increase that you're making in business license, for example, is not fair because of 1, 2, 3 reasons. So if that discussion is not happening at that point, then the other thing that will happen, people will not pay, people will not come and acquire license, or others will close business and do something else, or will do business illegally, and that's what happens. Or others will go to court and say, look, they can come together, mobilize themselves and say, look, the county government is marginalizing us in some way because they're charging so much, we are not able to produce that kind of money from the business that we do, so we are running at a loss, and they go to court and stop you from as government from charging anything. or stop your budget completely. If you do, they want healthcare to be improved, for example, like Kong King says, and then you're building infrastructure, you're increasing more facilities instead of equipping and empowering the current facilities. Then they go there and then they don't get a medical supply. So they will say, okay, look, why are you building more facilities? They can even stop construction of the facility, because I mean they come from that place, and they tell the constructors, like, look, why are you building this facility? You don't need a facility. You go and talk to the county government again. So I mean, so it happens that county government will not be doing what they want to do because they are disagreements with the public, with the beneficiaries of this decision. So there are a lot of consequences that happens when public participation is not done correctly. But mostly our people have not understood, like we said last time, our people have not understood the benefit of participating in decision making. Sometimes we just complain, oh, we're not getting health services, we are being charged very high fees, for using certain service. But we have the chance of telling the government, look, you're charging us very high, or you're not doing the right thing. But we are letting those opportunities pass. And when those opportunities pass, and then it becomes a law, then we can reverse at that point. So we just persevere and say, okay, accept and move on.
Yeah.
We like that.
But again, they also can't force themselves. If the government itself can't engage them in the decision-making process sincerely, I don't think if it's easy for someone to come from out and say that I want to know how this process happens in this county on following up on things.
It is. It is. The government is just to facilitate. So public, if government doesn't facilitate the process of this dialogue, then the public can force the government to have the dialogue.
Okay, they can.
Because they have the power. Look at the Article 1 of the Constitution. The sovereign power belongs to the people. And they can make any decision. They can use that power. They can exercise directly. Okay? By one, if they understood, for example, the process of making certain decisions, and they know the timelines. So they know in a given period of time, something is supposed to happen. And then if that thing doesn't happen, then they can go to the government and say, 1, 2, 3 things were supposed to happen according to the law, but it didn't happen. For example, about the CFSP. So if the county government doesn't consult public on CFSP, and then the 28th of February, which is supposed to be the deadline, passes, and then the public is like, we've not seen the CFSP, they can come to the county government, they can, organize themselves and come to the county government and demand, what happened to the CFSP? We were not consulted. If you tabled it in the county assembly, then that's an illegal document. And the assembly will not approve, because if the public are raising issues, then the assembly will also say, okay, we are the representatives of the people and we can go against the people. So you see, they have a lot of opportunities, they have a lot of windows. It is time to utilize.
Okay.
Yeah.
Thank you so much. We are taking a short break, but we still have a lot lined up for you in the program. Don't go too far.